time I had a sharp focus and a visualization of the finish line at the start line. In 2016, it was only to me the start line. I did not visualize the finish line, but I did not visualize the journey. But here in 2017, I could visualize the journey, the finish line. I had a strong team, strong strategy, and a strong crew, which really helped me, reach the finish line. 11 days, 18 hours, 17 was the day where I reached the finish line of a race in America. It was a sense of relief and also a sense of accomplishment for me. I was confident quickly reaching there. Started on 13th June. It's usually a Tuesday. Every time since 1982, it starts on a Tuesday, the second Tuesday of June. Pleasant 20 to 25. The moment you finish 80 miles, you are in the deserts of California. The temperature soar up to about 45 to 46 degrees centigrade from the 22 in just 128 kilometers. Peacekeeping force and for the them how to ride a bicycle and to help them with meditation and yoga, which is very new to them. So I ran 100 kilometers in 12 hours and could raise funds about $2,500 to get 14 bicycles, and in 6 months. Surprised in 2 or 3 weeks they could ride a bicycle, and which I did not expect. And also it's a taboo in South Sudan for a woman to go hike, and probably the most important thing that they taught me was the purpose. South Sudan, even for water, even for basic necessities, they are struggling till date. For our care. It will take a lot of time for the Maggi biscuits, which we don't eat so bound to time, So I would feel there is nothing bigger than time, So that is the biggest learning realizing this in the middle of the race. Everybody are racing with a given time. It is how much you are efficient in that time is what makes the difference. This happened at time station. Actually, I will do it every single year. I tell you that the impact of this race is so much. The impact of every day for me, I think, I dream, I do something with this conviction about the purpose of life, about these things. In the span of just 2009 to 2023, not much, 14 years, that's it. So when I see the learning
suffering physically brings best out of you. Purpose of life is to make positive impact on others, bring happiness and in others' life. What you want and what you get are in your hands. Be efficient with time with what you have. Learning to push your boundaries is beautiful.
Smile, sir. Some more.
Exposures of higher concentration, the olfactory fatigue occurs and there is no sensation of smell. Hydrogen sulfide causes inhibition of the cytochrome oxidase system, resulting in lack of oxygen in the cells. Anaerobic metabolism causes accumulation of the lactic acid, leading to metabolic acidosis. Employees working in some of the microbes that cause fish to rot produce hydrogen sulfide. Vertigo, intense anxiety, convulsions, unconsciousness, and respiratory failure. After resuscitation, victims may suffer coordination and psychiatric disturbances, including hallucinations and amnesia. Symptoms of obstructive airflow are almost exclusively in asthmatics, consistent with their hypersensitivity to toxic gases. Yes, sure. So, highlight this equation with stridor. Hydroxycobalamin, which is a part of the antidote for cyanide poisoning, is the antidote for hydrogen sulfide as well. This is vomiting, loss of consciousness. Patients will have to perform the responsibility of CPR was probably reduced as you, but they also collapsed. Case 3 successfully removed case 4 from the time and became breathless. Case 5 and 6 later pulled out case 1 and 2 without any limiting results. Case 1 and 2 immediately received CPR but did not have return spontaneous circulation. Suspecting hydrogen sulfide poisoning, case 3 and 8 received hydroxycobalamin immediately. The team of 8 healthcare workers were involved in treating these patients, of which 2 were asthmatics, case 7 and 8. Both of them had an acute exacerbation of asthma following exposure to the fumes that were emanating from the contaminated clothing of these patients. One required hospitalization and the other was treated on an outpatient basis. For case 1 and 2, case 1 and 2 were 33-year-old and 27-year-old male. The autopsy revealed that their lungs reports are available. So case 3 is a 26-year-old male with no comorbidities. He came in a state of loss of consciousness and they were breathing. With anaerobic metabolic acidosis with appropriate respiratory compensation. And injection hydroxycobalamin was immediately. He was extubated on day 2 and the morts resolved on day 5. He was discharged on day 7 of admission. Case 4 was a 35-year-old male who was tachypnic. He had lost consciousness but he had regained consciousness at arrival to the hospital. He also had elevated leukocytosis, whereas his renal and liver function tests were within normal limits. This patient also received renal function test as well as liver function tests were within normal limits. They also received hydroxycobalamin and were managed according to the standard case. Investigations, case 3 and 4 had elevated leukocytosis and case 3 had free-range involvement were more common in our patient and we did not see any cardiovascular ones in Canada and another in the Middle East. Hydrogen cyanide poisoning patients will also have pulmonary edema and more cardiovascular symptoms predominate.
They hardly live, no hydrogen sulfide.
Yes.
They hardly live. All the patients are survived.
Yes, this is where hydrogen
So what
sulfide.
makes you feel that the differential between the hydrogen sulfide? So this is cytotoxic.
Yes, even hydrogen sulfide is cytotoxic.
They have lived.
This was hydrogen sulfide poisoning. So that's why
That's
it's
right.
likely.
They have lived.
Yes.
So that's why I'm asking.
That's
Why didn't
in acute phosphorus cases at admission and on third day and on fifth day of admission. To study correlation of reactive phosphokinase and lactate reactions there with acute body poisoning based on paradigms, organ phosphorus poisoning stories for prediction of prognosis. Study period from September 2022 to October 2023. Study set patients of organ phosphorus poisoning admitted imaging in general medicine wards in my college exams now. Sample size 100. Inclusion criteria of suspected cases for more than 12 years of age. History of ingestion or inhalation of opium for moderate and severe cause. This false for abnormally high levels of calculated false for patient. Laboratory examination of serum producers was said and patients will be classified according to modified protocol classification. Mild poisoning, moderate poisoning, and severe poisoning. Periodic biological estimation of serum reactive phosphokinase and serum LDH.
Day 3, day 5.
423, 398 and 375 respectively. The values of both the parameters decrease as the day increased. In CPK level, the mild and moderate at day 0, day 3 and day 5, there is decrease in LDH level. And similarly, we observe mild and moderate group of patients. The oxygen is same because normal is significant. And mean CPK level compared to day 0, day 3, day 5, and mean LDH level compared to day 0, day 3 and day 5 are found to be significant. Statistically different difference in CPK level day 0, day 3, day 5 on terms of coverage. We observe reduction in CPK and LDH level in treatment in mild cases and similar changes in moderate cases. All of these cases have severe grade of poisoning according to box test, and this was statistically significant association between cooperating and outcome, as all cases have direct and single trend. Conclusion: maximum cases 58%. Can be easy and available biochemical marker to assess mortality of the organ phosphorus. The serocondition is mostly a diagnostic marker, not a prognostic. Can be prognostic. There is a study, various studies, and there is a they will experimentally introduce OP compounds and they will rather might find it of the the range was 0.38 to 0.41. T3 79 hypothyroidism was based on serum TSH levels when found between 4.5 and 10. With normal serum T4 was
after high-flying topics. After flying very high with advanced topics yesterday, it's back to basics day today morning. In the morning, we will begin with talks by Dr. Abhay Bhave, well-known hematologist from Mumbai. He is going to decipher the most common investigation of clinical practice. Before, we are very fortunate to have with us Dr. Divik Kadam sir to grace the inauguration ceremony of Australia. Over to you.
How to interpret the report of CBC that comes to you. But I can't start this discussion without paying homage to Wallace Coulter. Coulter counter is something that we grew up with. Most of the hematologists of my age would have used Coulter.
And what we have is a giant where we can run multiple samples with the help of vacuum which are bar run through within about 40 seconds, over 1.5 minutes. We are able to get a CBC printout, which is the fastest. We do two things. One is it can be a stained peripheral blood smear. The staining is immaculate and therefore reading the slide is good, and soon we are going to get counters that are making 4,000 answers are wrong. This is good or bad, I don't know, because it is good to show that a student should go to the length of the road. This should be
Can't actually work without a quality assured complete blood count. So when a printout comes, you get lots of numbers. I hope my arrow is seen here. Then you get the indices which tell you the quality to that quantity. So in quantity to the fixed, but mean later volume tells you the cycle. Because the scale is okay. As Akash is telling you, 70% of the time the answer comes in the GI tract. All my other patients are undergo bi-directional endoscopy and advisor of the American Gastroenterology Association, and all of them will be suffering from about 25. Now, you get into this what has happened? The hemoglobin from 6.6 has become 10.6. RBC count has become normal. But look at the indices, they are still low. What does that tell you? It is a improved because iron deficiency is occurring. This patient's indices are still low, although the RBC has come up. Also, the MCHC has come to normal. Now, this is again a hypochondrial microcytic anemia, but you treated the iron deficiency. So now you have to look at hemoglobin levels. There is an underlying hidden hyperthalassemia trait, and that will improve by doing it. The first so the A2 comes high. So don't be fooled by one report. Go to read it. All of us in this audience should be like Sherlock Holmes. You should not give up till we are satisfied that we come. Now the same hemoglobin of 6.6, you know, this is time that the WBC count is going to be. So when it is 6, look at the hemoglobin, look at the white count, look at the ratings. That's the first thing starting point. Then go to the quality of it. If you see now the LCD is high, unlike the previous one, this is a microcytic anemia. RBC count is low. And this classically, in Nair Hospital and Sign Hospital, when we had patients like this, you do not do B12 tests. You treat them as B12 deficiency because this is enough corroborative evidence along with a good CBC that this patient has B12 deficiency. So this is very good classification. Nowadays we treat this. I don't do this on pernicious anemia. I refer out to a gastroenterologist after GSOP. We do for gastric right? We do biopsies and you know that pernicious anemia has a higher risk of getting a malignancy in the upper GI. Hemoglobin refers to non-hemoglobins, and we got the first case of hemoglobin oligopolia in the country, which we have published with ICMR, and we also got the family. The history in the family is very important. And next generation sequence is something generally where we should now of PCR and depth for the circulation is the autonomy as well. And look at this now, 13.9 hemoglobin, the white cell is 7 lymphocytosis. And now your thinking has changed towards a lymphoproliferative disorder. So you're looking at something which is lymphoproliferative, fever, nothing of the sort. And the community responded to the so we have yes, we have currently fevers, but this is a minor same number, just in the number of thanks to your fever and thanks to the overseas side. Most likely the overseas would be there. There was done in CMN, you look for fibrosis, you look for stage or phase of the disease, and you do side design to see for additional scientific abnormality. And unlike CLL, we do not wait. CML is treated immediately, highly treated. So one gene, 1 point mutation. So Philadelphia chromosome, 9 nucleotransformation. Brilliant treatment available in the form of TKI, tyrosine kinase inhibitor. And that's thanks to Dr. Drupa and Janet Rowley that we were able to do this.
We are just focused on this AVNRP and term.
So that much you have taken?
Yes.
So rest is
India sense of us and curiosity of to see what happened. In this case, there was a scuba diver who died, who did a scuba diving, and to drive, you always experience something called as G forces, like GX and GX most commonly when you drive on the road. But when you fly up or when you take turns in the aircraft, there's something called
Kolhapur. Sir has published many original research articles in various national and international journals and has
One system that you must have come across getting involved is the respiratory system. However, if you look into it, there are other systems those can be getting affected because of the COVID-19. And let us have a journey of these the non-respiratory manifestations of the COVID. Let's see in the right now. To coronavirus, it is positive sense standard RNA virus. First, it was recognized in newborn. This is the structure that is there, the most important structure of the virus. But the particle that is there is the spike protein. The transmission and the contagious period can be 3 days before the symptom onset, 8 days from the onset of any symptom. This is the structure that is there. The most important thing is this virus has got specific correlative meaning thereby we have the ACE2 receptors. Wherever these ACE2 receptors are going to be there, pre-existing cardiovascular disease may have higher levels of the ACE receptors. They are there in the renal tissue, the gastrointestinal tissue, hepatobiliary tissue, pancreatic tissue, neurologic tissue, and the ophthalmic structure, arterial and venous endothelium, and also other structures like say skeletal muscle. So basically, this virus is going to get attached to the ACE receptor bearer. And if you see which organ is spared here, no organ is spared as far as these ACE receptors are concerned. Only thing is important thing that is to be remembered is the hepatobiliary system where the cholangiocytes are being affected and not the hepatocytes, and that's why the hepatic parameters, hepatic abnormalities, those are going to be there, are not going to be of the hepatic.
particular talk in various clinical subsets. In fact, I was in a webinar and somebody told me that I don't understand AI at all. But somebody told me 10 years from now, you just feed your heart rate and you will get your scientific horoscope telling you what date you get your first MI. That is what they are trying to predict. It is 100 years. And now, 40 for 50 respiratory rate, percent 100 is for 14 years, and so on and so forth. That's an example. This I am just reading because there is a mention this. There is one is a fixed number of heart rate to respiratory rate. Who decides and forget about it. But this also you should decrease your heart rate because you will live longer. This was in 1997. So what we are going to look at is in this talk we are going to look at different subsets, clinical subsets. Over a period of time you have to have some events, cardiovascular or cerebrovascular events. This is for general, in general public, no disease. Heart rate atherosclerosis, higher the heart rate, higher the progression and higher the incidence of plaque. If you have a sudden surge in your diastolic pressure and heart rate, at a bifurcation you are going to have a plaque. That is what the heart rate surge are likely to have a plaque rupture and infarction. You have to be careful. And there are several studies for atherosclerosis. Interesting studies, a correlation of heart rate to calcium score. So higher the heart rate, higher the calcium score, higher the atherosclerosis. And that is why we must see what is our heart rate in, what should be our heart rate in your DNA. All those who stress test, interesting paper, immediate 7 years ago, 10,000 patients followed up for 15 years. Only by this heart rate profile is on a stress test. Stress test negative for ischemic heart disease. Except post-MI, post-heart failure, hypertension, specific indications used with otherwise beta no mention. Besides regeneration, beta blockers as an initial anti-hypertensive therapy, and what they have clearly mentioned, see this 2023, can be used as monotherapy or
Everybody, I was director of Ambedkar Hospital till I got married. After I got married, I became assistant director. This is just update. And it starts with this slide of a double drug, or it can be because of multiple drugs at the same time. So, one disclaimer before you can use the drug. You can use the drug by increasing the frequency, decreasing the frequency and increasing the interval between the use of the drugs. Or third, you can combine the both, use a lesser dose and increase the frequency. So all these three, to just give me some time for the discussion part of it. Okay. Now, if you give a right answer, the first question will go to the audience, and if you give the right name and dapagliflozin, she was started on amikacin 500 mg/d after admission to the hospital. I don't know why orthopedic people like amikacin. ते अजून मला कळलंच नाहीये, पण त्यांचा drug of choice is amikacin. Okay. This was a fracture. She was taken for surgery at 2 p.m. आणि unfortunately कोणी सलाईनच लावलं नव्हतं. तसंच होत्या त्या आणि सर्जरी was successful. All surgeries are successful. तुम्हाला काही डाऊट वाटतो का? काहीच प्रॉब्लेम आला नाही. Okay. And the unfortunate part is she was noticed to have decreased moving output. Any investigation of this disease. सर्जरीमध्ये विचारल्यानंतर given. Terma is discontinued, glycomet, dapagliflozin, insulin was given, IV fluids was. Your comments, Dr. Praveen, on use of Terma. Use of diabetologists realized that patients are getting acute kidney injury, patients are getting urinary tract infection. मग हे असं का होतंय? म्हणून मग नेफ्रॉलॉजिस्ट बोलवलं. तोपर्यंत ते डाबा-सीकेडी ट्रायल पण झाली होती. म्हणून मग म्हणलं आम्हाला कशाला कॉल करताय? मग हे लक्षात आलं की साईड इफेक्ट्स ऑफ SGLT2 इनिबिटर्स वर कोणी आधी बोललंच नाही. प्रत्येक जण याचा छान आहे असं डिस्कशन करत बसले. सो बी केअरफुल. And I think if you are orthopedic surgeon insists on giving amikacin or Govira and change the orthopedic surgeon, he needs. And why amikacin and use tramadol, telmisartan? Basically, can I have a scholar mic? Basically, what happens? See, basically, when you and Terma is going to cause post-glomerular vasodilation. So your GFR is probably wrong if you combine both. And you have to realize this, inhibitors also produce a drop in GFR. So my personal advice to you is don't start with telmisartan or an ARB-ACE inhibitor plus SGLT2 at the same time. You are going to like. She as usual has missed dialysis. आठवड्यातून 3 वेळा So anything else? जरा audience ने विचारायचं बाकरवडी की परत घरी येऊन जाणार नाहीये. त्यामुळे तुम्ही इकडेच संपून टाका. मी इकडेच गेली आहे. काय
these situations make them more
on that I will decide the toxicity. Okay. So.
Thank you very much. I'm very upset with the organizers. So, in front of a very colorful event, I'm not reading it, you're reading it. In short, young female with ITP 5 years ago, she was treated with responded blood drugs. Had a child about 4 years ago, uneventful platelets did not drop. Hemoglobin was had dropped 9.6, lasted until 11.8. This time she is dead. Possible pathophysiology. That's ITP, hemoglobin will not drop unless there's some other reason. Hepatitis with ITP are not showing liver enzymes. Dengue with ITP, dengue will drop the platelet count, never reduces the hemoglobin, will actually hemoconcentrates. Even a syndrome causes low hemoglobin, low platelets, tests. Review shows normal platelets now, hemoglobin is 1.5 grams. What is this pathophysiology? Thrombocytopenia to begin with, Evans syndrome, cortical sinus thrombosis now at different times, not at the same time. So not a similar pattern. What is happening to what is happening in this case? Any thoughts? Collagen? SNE. Yeah, okay. So we did studies for that, and then we got a schedule. Further investigation revealed a fractured neck of femur is posted for surgery after 24 hours of the pain. At the end of session, she had no medical answer, and investigations were made.
patients develop sudden onset breathlessness and also a less-sided chest pain. But retrospectively we are wiser, and when it is presented in this manner, it becomes easier. But suddenly we get a thought, what happened? 6:30 am, patient had a cardiac arrest at home and could not be revived despite intensive CPR.
Sir.
We shall now begin with the most introduced on the dais. Chairman of KPI Kolhapur, Dr. Prakash Sharmendle. Thank you. Now I invite all the dignitaries for the lighting of the lamp.
distinguished speakers, attendees, and enthusiastic delegates.
you all for the 10th edition of this KAPICON. We API Kolhapur Association of API Kolhapur have a total of 170 members. The registration for this conference has exceeded 400 members. There were 25 medical college teams to contest in the quiz. And our delegates, those who are attending from all the nearby cities and including Western Maharashtra, Goa, North Karnataka. The numbers itself speaks why I call it as a regional conference. So this has been an unwritten rules we have been following for years. As we know, all the conferences, the main backbone of any conference is an academics. As a doctors, we always try to attend conference, gain some knowledge for the benefits of the patients. The main thing which remains on our mind is how this thing can be beneficial for the patient. On various human aspects of the physician, what physician should be doing. And we kept some extra academic sessions like quiz. We displayed the arts by our own members, which have been displayed on the corridor. The cultural program was totally conducted by the that event. And it was absolutely amazing. We have attended this event. We also focused on the security aspect also. At 7 a.m. there were almost 30 people in the hall.
Dr. S.K. Kulkarni sir was the first.
He was born on 16th June 1931 in a small village called Kolhapur between Nana Railway and Anandi Railway. His father was a farmer by profession. Later in life, he was adopted high school Kolhapur. For higher education, he joined Rajaram College Kolhapur.
Now I invite Dr. Amardev sir on the dais to read out this.
Good morning, everybody. The citation reads as follows. Association of KAPICON 2024, with great pleasure and utmost pride, we felicitate Honorable Dr. Dilip Kadam with Dr. S.K. Kulkarni Innovation Award. We, the members of Association of Physicians of India and Kolhapur, feel elated and immensely proud in having you as a guest orator on this occasion. Sir, you are a distinguished teacher and insightful clinician. After retiring from BZ Government Medical College as Professor of Medicine in 2017, you continued your academic pursuit at SK Medical College as Professor and later as a Dean. You continue to render your dedicated services as Officer on Special Duty as of today. As an esteemed educator, you combine an infectious enthusiasm for teaching with genuine commitment to patients' well-being. Your engaging approach, impeccable clinical acumen, coupled with deep understanding of medical intricacies, success of your students and respect you earn from colleagues is a testament of your exceptional ability to inspire and impart knowledge for all those who are
diagnostic abilities, and accuracy of treatment. No wonder you are highly respected by students and peers, but also have an enviable record as one of the most trustworthy physicians for the patients. Your collaborative spirit, willingness to share insights, and dedication to advancement of medical education is well reflected in nearly 60 research papers you have published in national and international journals. Your skill set to articulate ideas and captivate the audience through effective communication has made you a much sought after speaker in various conferences. Your eloquent speeches on various topics in nephrology, endocrinology, and internal medicine as a faculty had a mesmerizing effect on audiences in more than 40 national and international conferences. As an author, you have a very significant contribution in various publications and textbooks, including API textbook on a wide range of topics in internal medicine. You have an impactful contribution in society in various ways, and it extends beyond the scope of a teacher and a clinician. You have headed the task force of government when COVID was a threat. You have been part of many committees of government and various universities looking after training and discipline of medical and paramedical professionals. Your deep commitment to addressing various issues in education, administration, individual and societal health has been awarded by innumerable accolades by reputable institutions and authorities. Master Teacher Award by API is just one of those. We at API, Kolhapur, acknowledge and respect your outstanding dedication and exemplary contributions in the field of medicine and healthcare. We are sure that your exceptional accomplishments would inspire others to follow your footsteps. We take this opportunity to honor and felicitate Dr. T.P. Kadam, an inspiring teacher and an astute clinician at this KAPICON 2024, and wish him a continued success and long healthy life. Thank you.
Thank you, Ambassador sir. Now I request the chairman, Dr. I also request you to felicitate him with a short speaker and a moment.
So I would say first Akshay of 19 API Kolhapur for giving this honor. I really don't think that great and seems have been grown out of proportion. Even by Dr. Ambedkar sir also. So whatever we used to do for the betterment of the students, we are trying to do that. I was in Kolhapur in 2005 and headed Department of Medicine. So I know most of the faces. When you started putting feta and all that, मी माझ्या लग्नात फेटा घातला नव्हता. So that's an experience for me. आणि when I was intern in in 1978, we had a teacher who was 92 years of age and used to die. So all of them said, it was a and we arranged lifetime achievement award and all that. But then they said, okay, it was again there, so I'm also the same. You know, if you do me, when I own this, I'm still doing a lot of offer for something like that. And my cool mom put the so let us go to this topic. First, I came my research was grade 7 to 4. When question came, what should I talk on? Basically, I remember first time in H1N9 and COVID. So the topic has essentially a tale of two pandemics. But then Professor said roughly, climate change is the topic and which has to be discussed. There are a lot of things which are coming up for the same. Let us go on to do that. Then I started thinking, how should I do it? So in the outline, first we'll see basic concepts and indicators, human health impact, system-wise affection, Indian scenario, and what can be the solutions like. And along the path, I will be trying to tell you my experiences regarding what climate change and how the practice changed for me in the last 44 years. Sweden now. We'll see what the Sweden is facing now. And some part of Asia and Africa. In Asia and Africa, it's totally away opposite rate. That is droughts and this in the rainfall leading to food scarcity. And we have seen the tropical cyclones in India. The frequency has increased and has increased major problems associated. So if you look at the temperature, energy, atmospheric composition, ocean and water and biosphere, we have several parameters to look after. Those parameters are surface temperature, ocean heat, distribution of carbon dioxide, sea level rise because of the temperature, and if there is a reduction in the acidity. Ocean acidity is becoming more acidic, glacier size is reducing, and sea ice is reducing. So what are they for us? So if you look at this complicated thing, what we have said, these 5 things we have looked after. So this has led to slow down of global temperature, thermal circulation. Let's see with me, help me back.
For KAPICON 24 and our delegates. It is my privilege to propose the vote of thanks on the occasion of inauguration ceremony. First of all, on behalf of API Kolhapur family, I am extremely thankful to our chief guest, Dr. Dilip Kadam sir, for honoring our invitation without even giving a second thought. He has added a golden lining to our annual oration by his ability to explore the complex subjects like complex experience. I would like to express my gratitude to our invited speakers, Dr. Abhay Bhave, Dr. Niranjan Ambekar, Dr. Sunil Sathe, Dr. Pankaj Palange, Dr. Vikram Rolhe, Dr. Akash Shukla, Dr. Arti Bose, Dr. Santosh Thakur, Dr. Shrikant Solo, and Dr. Swanand Bhola for giving us new insights in clinical medicine and covering various tricky and puzzling issues in the clinical practice. I thank Dr. Sandeep Shrotri and Dr. Srinivas Gokulnath for their out-of-the-box talks on nurturing hobbies and aerospace medicine. I thank Dr. Akshay Bafna for orchestrating the medical quiz for giving KAPICON an exciting start. I thank all the judges for their painstaking efforts for evaluating the quiz as well as papers and poster presentations, which were more than 60 this year. I thank Dr. Amol Koth and Dr. Nilesh Dhammi for coordinating the event. Event like this cannot happen overnight. The wheels start rolling one side. It requires utmost patience, enthusiasm and micro-planning. I thank our Honorable Chairman of API Kolhapur, Dr. Prakash Sharbidre, Vice Chairman Dr. Amol Koth, Joint Secretary Dr. Charmi Koth, Treasurer Dr. Nilesh Dhammi, Dr. Abhijit Ganpule, Dr. Shriya Gadwe, Dr. Amar Jagtap, Dr. Nitin Kesarkar, Dr. Padmaj Badbade, Dr. Ranji, Dr. Sandeep Shavasti, Dr. Girish Hiregaonkar, Dr. Niranjan Rathod, Dr. Tanmay Hora, Dr. Amrut Sultani and Dr. Rahul Gilani. I thank all honorable members of API, past chairmen, ex-members of advisory committee and all seniors for always encouraging us and making KAPICON 2024 a successful event. I expect such invaluable help from all of you in the future. I would like to extend my thanks to all the delegates who turned up in great number, many of whom have travelled from distant cities. I hope they are enjoying the event and any suggestions from them are always welcome to improve the future editions of KAPICON. I would like to acknowledge the postgraduate students, their teachers, departments for giving overwhelming response to quiz and paper and poster presentation. I thank Dr. Shirish Kulkarni and Dr. Kolhapur Madam for their persistent support to API. Lastly, I thank MNC observer Dr. Vijay Garge sir for sparing their valuable time on weekend for us and constantly helping us in proceedings of KAPICON. With this, I complete my vote of thanks for the inauguration ceremony and hand over the mic to MOC Dr. Charmi Khoth and Dr. Shreya Gadve, thanking them for their immense help in running the show smoothly. Thank you.
Thank you, madam. Audience members to kindly give him a standing ovation. Thank you, audience members. Thank you, sir. We shall now break for lunch. Post lunch, we will have the prize distribution ceremony and the valedictory function.
He's an army.
feeling of spinning with the balancelessness. Only when it is abnormal, then only patient recognizes that something is wrong. And because a person is so rarely conscious of his own vestibular system, he has a great deal of trouble describing his symptom. Now, I'm going to show this video, but before that, we all know that our ear has got our balance system, and we all must have studied in our anatomy that we have got a vestibular labyrinth, which is a semicircular canal, and utricle and saccule. Semicircular canal, which is related with the angular acceleration, and utricle and saccule is related with the linear acceleration. One left side lateral semicircular canal to the opposite to the fellow of the balance system, because as far as semicircular canal is concerned, this nodding movement is for the anterior and posterior. This movement is for the utricle, front and side to side, and this movement is for the saccule. So observe this video from the angle.
Congratulations. Certificate and cash of rupees 8,000. Trophy, certificate and cash amount 6,000 rupees. Imbalance of promoting microangiopathy in patients with a snake bite injuries, hemotoxin innovation, specific care center. After this. PDP Pharmaceuticals. 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 Last but not least, Alembic Pharmaceuticals.
Malik for conducting the event. Mr. Lohar. Mr. Lohar. Mr. Milind.